Good evening, everyone. Good evening, good evening. Welcome to Stonehouse and the headquarters of the Arboricultural Association. I almost couldn't say where I work then, but that's what it is, the Arboricultural Association. My name's John Parker, Chief Executive Officer at the Association and your host for this evening. Please say hello in the chat, let us know where you're watching from, but select everyone when you do so. Otherwise, you'll be like Angus and it'll only be the panelists who can see, and nobody else will ever know that Angus was here unless he re-enters his message to everyone. This evening, we'll be hearing from Bianca Ambrose-Oji and Vadim Saraev in part one of a two-part series we've arranged with our colleagues at Forest Research as part of the build-up to Conference 2021, Trees and Society, for which you can buy tickets right now. It will be held on September the 6th and 7th via Zoom. It's going to be absolutely brilliant, so please do get involved. There'll be a link appearing in the chat at some point, I am sure. Part two of our little mini-series next week will feature Liz O'Brien speaking about the cultural ecosystem benefits and shared values of urban and peri-urban green infrastructure. And Joe Barton will be speaking about identifying the key links between perceived biodiversity and mental health. You can register free for that one right now using the link available in the chat, so please do so. One other notice for tonight, the Arboricultural Association has created two new awards to be presented at conference. Student of the Year and Young Arborist of the Year. These are brand new awards. We're looking for nominations, including self-nominations. So if you think you know someone, or if you think you are someone who deserves a bit of recognition, please check out the website for more information and get your nomination in. I can stick a link in the chat to that one in a bit, but it's worth having a look, so please do so. Right, on to this evening. Remember, use the right option in the chat before making your comment. Submit your questions using the Q&A button. If it's a specific question to someone, then please make it clear who that question is for. We'll work through as many as we can at the end. As ever, if I don't ask your question, you can email me, john@trees.org.uk, and we will send your question on to our speakers at a later date. And that's about it. Good. Was that quick? It felt like it was quick, but I do talk a lot. So let's go. Let's carry on. It's now my very great pleasure to invite our first speaker to the stage, who is going to be Vadim. Over to you.
Yes. Hello, everybody. And I'm very pleased to be able to present some of our research today. Let me share my screen to show you the slides. So it's the first slide. So I will be speaking today about valuing the health benefits of forest and trees. How can this be done? And as you can see, there is a long list of authors here. This presentation will cover a number of research projects we completed recently. So lots of my colleagues from Forest Research contributed a lot. So the first slide is a very brief overview of what I'm going to present. So I will speak about 3 research projects united by one theme, which is the health benefits of trees and how to value these benefits. And the 3 projects are, first one, a scoping study on valuing mental health benefits of forests. This one came to our sort of attention, and we were asked to do work on this late in 2019. And we completed it in April 2020. The second project was developing an approach to monitor health and well-being benefits of visits to Scotland's forests. This came from Scotland Forestry and Scottish Government, and this was completed in December 2020. And the third project, valuing mental health benefits of woodlands, avoided cost approach. This one was completed just recently in April 2021. As you can see, it's a whole bunch of projects of very similar theme, and we were really surprised to receive them sort of as a one bunch, one after another. It's not very often happens in research. I should mention that all projects were quite short, 4 to 6 months, so they're not in-depth original research, but rather desk-based literature review and a bit of original estimation to get the numbers for mental health benefits. So what we find out is that both mental and physical health benefits of visits to woodlands can be valued. So physical health benefits can be estimated through the types of physical activities performed in nature. Mental health benefits can be estimated through the association between reduction in the likelihood of developing anxiety or depression or any other mental health condition and frequent visits to nature. And the take-home message, if I'm broken after this slide, is that measure and monitor what you want to value, and natural capital value of mental health benefits of UK woodland is above 12 billion, while annual benefits are over 200 million per year in 2020 prices. And I should mention here, before I move to other slides, that I use woodlands, trees, and forest terminology as meaning the same thing. It's basically any green space where trees are a prominent feature. So because all projects were named slightly differently, you can see that we float between forest and woodlands, and of course we mean trees all the time. Also, I was told that the audience is quite international, so I would just confirm that a billion is a number with 9 zeros, and a million is a number with 6 zeros, just in case anybody will be confused. So now to the actual presentation. So as you saw, 2 projects are focusing on mental health. So this is why the bulk of presentation will also talk about mental health benefits of woodlands and trees. And the outline of presentation is very standard. I will speak first about motivations and aims and objectives. I will then briefly mention methods we use in our research projects. So it's mostly reviews and expert interviews, work with public surveys existing currently in UK, which monitor visits, and economic valuation along the natural capital accounting lines. And then I will present results, which basically show how and what we can and should monitor to be able to evaluate the benefits of visits to woodlands. And I will conclude with some recommendations and research gaps, as unfortunately we scientists like to do. So first, the motivation. Well, apart from what's written on the slide, I'd like to remind everybody that we are, of course, still in the midst of COVID pandemic, and nearly everybody reported that people are really flocked to the nature when they can during this pandemic. First, because lots of limitations were imposed on people to meet in public places. So nearly everybody went outside if they could. And I think also we see a significant increase in mental health problems in general, also associated with this pandemic. So I think motivation is very, very clear. We need to see whether nature, and specifically trees, woodlands, and forests, can help with mental well-being. So I start by saying that growing volume of evidence of associations between woodlands and improved mental health. And under improved mental health, I mean reduction in psychological stress, anxiety, fatigue, or depression, increase in mental well-being, and reduction in health service treatment costs, as well as work sickness absence rate. This is what is constituted sort of positive things in mental health. One thing to notice is when we do a search on Scopus, which is our research database of all publications, we can see a 10-fold increase in publications related to mental health. I put here a number from 2000 to 2020, which is a time span we used to do our search for the literature. We saw increase from 99 publications to over 1,100. So more than 10-fold increase, certainly showing that mental health and woodland is not a niche and dormant area, but rather quite flourishing and well-developing. But despite all this sort of growing evidence, the last red box on the slide conclude that, however, there remains a significant evidence gap in estimating associated economic values of these benefits, and I gave a reference there as well. And me being an economist in forest research is actually, as you understand, most of my presentation will be trying to see how we can value mental health benefits. So aims and objectives, very straightforward. Overall goals: examine existing evidence on health benefits of trees, including monitoring visits to forest, propose steps to monitor and to monetize these benefits. Specific objectives were review existing literature, focusing on methodologies to monetize the benefits, highlight relevant impact pathways and logic chains, which bring us sort of from person visiting woodland to us noticing some changes and being able to put some monetary value on it. Identify metrics which are available to monitor, measure, and monetize these benefits. In addition to literature review, we also did interviews with key stakeholders and experts. And finally, provide recommendation how we should monitor these benefits, how we can monetize them, and what's the potential to incorporate these benefits into natural capital accounting framework, which is very important for government decision making. So going into methods which we use to complete our studies 1 and 3, which are related to mental health valuation. As mentioned already, it's a literature review. Our project team was completed also with 2 expert critical friends, what we call, one external academic from another university, and a practitioner. And practitioner was actually practicing mental health nurse from Scotland National Health Service. Actually, not Scotland, from Wales. The person was from Wales. Sorry about this mistake. The database search was Scopus, which is, I think, one of the biggest, if not the biggest, published research database. And Scopus also covers over 90% of Medline publication. So anything published by medical profession is covered too very well. And our search span was from 2000 to 2021. But of course, we try to focus on the most recent papers. So maybe you can say from 2010 onwards. It was complemented by expert interviews. So we managed to get agreement from 12 experts, both academics and practitioners from public and private sector, to give interviews to one of our researchers on the topic of valuing mental health benefits of woodlands. This was only done for the first study, the scoping study, where we basically just tested the waters, trying to understand what we are looking for. And finally, when we come to valuation, we use natural capital accounting principles. And I just put here as a reference for people who may not be familiar with natural capital. There is a publication enabling a natural capital approach, abbreviated NCA. It's a guidance published by UK government. So I have a link in the slide too. I hope if my presentation will be available, you will all be able to follow this link if you want to see this guidance. Method used for the study focusing on monitoring visits to Scotland Forest was again a literature review, but in addition to this, we explored existing public surveys. And I have a quite number of abbreviations here. I will tell them in full. It's Public Opinion of Forestry Scotland, POF. SPANS stand for Scotland's People and Nature Survey, and SHS is a Scottish Household Survey. These are 3 major surveys run in Scotland which record people interaction with nature. And the idea was to suggest additional questions which can be used to monitor benefits of visits to Scottish forests. Also, we spent quite a lot of time exploring sample size issues of these surveys to see that the sample size is adequate to cover many quality characteristics. This was sort of a specific request from Scottish government to see what sample size they need to cover equality characteristics. And here I mean such characteristics like gender, age, race, and so on. What was suggested at the end of this method is a way forward, which we basically say the best way forward will be a bespoke longitudinal survey with specific metrics. And we also suggested an approach to value physical health. You will see how exactly when I come to results. Right. So this is sort of approaching results. And so when we speak about mental health and we try to define it, we immediately into the hot waters or fast waters of this multifaceted and complicated issue. Because as anybody will see who deal with mental health, it's encompassed both positive mental health well-being as well as mental illness. And this is also reflected in World Health Organization definition from 2004, where both sides, positive mental health and mental illness, are present. So mental illness reflects types of psychological distress, while well-being reflects sense of welfare or satisfaction. And physical health is also very intrinsically linked to mental health. And disentangling this relationship is very difficult, if at all possible. So currently we don't have any conclusive results which can totally disentangle mental health and physical health. And during our expert interviews, we basically confirmed with them that our literature search strategy is correct and we're not missing anything. So what did we find in our first study in terms of what valuation approaches can be used to value mental health? And here is a summary table. So approaches are presented in column 1. And then there is a summary and suitability for our research. And I will go row by row just to let you digest all this. First methodology we suggest to use for valuation is called QALY, which is standing for Quality Adjusted Life Years. It's a quite widespread and popular metric to value health. It's used extensively for comparing healthcare interventions. And it has ability to capture health value quite holistically. So it includes both physical health and mental health using specialist self-reporting metrics. The problem with this, you can see in the third column on QALY, is that because it is a holistic measure, it cannot actually very well disintegrate, or I would say disaggregate values into physical and mental health benefits, because it's the questions used to estimate QALYs coming from a self-reporting metrics like EQ5D or SF6D. If somebody would like to follow this further, the questions cover always both physical and mental health. The second approach we considered in our study was well-being valuation. And this one is based on real observable experiences. It has very broad applicability with any data set which report life satisfaction, or for example, SWAMPs. And SWAMPs stay for Short Warwick-Edinburgh Mental Wellbeing Score. It is one of the metrics which is widely used and was developed in UK. So what, in terms of suitability, positive mental health and well-being is relevant to every individual, and of course, making this approach very widely applicable to exploring welfare values associated with mental health. However, there are lots of issues of double counting with using this approach, because it's very difficult to disintegrate, or not to disintegrate, to disaggregate the specific issue why a person feeling very well. Meaning, is it because it's visiting some tree landscape, or is it because of many other multitude of potential issues which can be impacting his well-being? And the last methodology suggested was a avoided cost approach, which is a very conservative methodology focusing exclusively on benefits to national health care in terms of avoided illness due to visits to woodlands, forest, and trees. And this is actually the approach we used in our third study, and I will present the first results of this evaluations using avoided cost approach later. So still going on about how complicated mental health is, I present here a picture of an iceberg. And as many of you would know, the visible part of an iceberg is only 1/10 compared to what is underwater and is sort of lurking invisible. And we found it's a good illustration of our approaches to valuing mental health. So the tip of the iceberg, which you see, is basically what can be valued using avoided cost approach. So cost saved to society with very few issues of double counting, because we can evaluate very well, reasonably well, reduced visits to doctors, reduced prescriptions, reduced days lost in the labor market. And then there is a huge underwater bulk of this mental health question, which is related to positive mental health and well-being concept, and to this well-being valuation approach, which was in the middle of a table on the previous slide. And this is much bigger because it's, of course, account for positive mental health, which often is never recorded in any records, because if you feel good and visiting woodlands keep you feeling well, you don't go to doctors and you don't get prescriptions, so you are never recorded on a system. And also, by the same reasoning, also the benefits of staying good due to nature is actually never recorded unless we are doing well-being study. But as I mentioned already, there are lots of issues of potential double counting with amenity benefits, recreation and physical health, and in general, why you feel good and how to separate it from you feeling good due to visits to nature. And in the middle is a bit of a fuzzy boundary when we can use quality approach based on a quality value for welfare to society of these mental health benefits of individuals. You know, you can see quality mentioned within the red circle and also next to avoided cost approach. And here in United Kingdom, we have two different values for quality adjusted life years. One is quite high, which is used to measure welfare value, and one is significantly lower, which is used by National Institute for Clinical Excellence to evaluate cost effectiveness of health interventions. And this one is the value used in avoided cost approach, if required. Right. Still continuing with our mental health issues. And I think one of the most important problems there is the significance of exposure and response function. And I will explain it now through a couple of slides. So when we value mental health benefits, we always go through two steps. And the first step is quantifying the mental health impact. And we quantify it using some metrics. For example, it can be a self-reported mental health scale, or it can be based on directly observable characteristic. For example, we can take biomarkers from people of their cortisol level, which usually measure the level of stress. So we can take this swab before visiting woodland and after, and we can have an, in this sense, objective measure of changes in the level of stress, or through some interventions. For example, we encourage people to visit more woodlands, or we provide more accessible woodlands, and then we can see changes, for example, in prescription rate for antidepressants. And all this quantification significantly depend on exposure response function. Exposure to nature and how individual responds to this exposure. And the second step is already economic step, it's monetizing these changes in the metrics. And this monetization, again, significantly depend on these robust estimates of changes in mental health associated with forestry interventions. So this exposure response is significantly confounded by mediators, and I will now explain which are these mediators. So there is a nice picture here which shows you how this exposure response sort of working through. So we start on the top of a picture where we have natural features, for example, treescape on your right, which can be characterized by size, type, or qualities of this treescape. So we come and visit this place, so we expose people to this nature environment, and then people experience it in a very different way. And through this experience of nature, they receive some dose of it, you can say, so dose response story. And as a result, we have an effect, which is measurable changes in some health metrics. And the problem here is, of course, that everyone responds very individually to nature. And there are millions of reasons one person may respond very differently to another while visiting, for example, the same treescape, either due to their health or due to their psychological state at the moment, or due to their cultural values. And this is a table which summarizes the impact of mediators. So in the first column, we have characteristics which influence mental health when you visit some site. For example, you visit site, and you obviously, the impact is influenced by the size of the site, location of the site, number of tree species, and the mediators which mediate these influences is, for example, air pollution removal, which is always present in a site with trees, noise reduction, because you feel much more tranquil place because you're isolated from city noises and motorways, natural sounds, biodiversity, where you can sort of observe many tree species and other plants and animals on the site. Your exposure, again, which means duration and frequency of visits or type of activities you perform on the site, is mediated by such things like what kind of physical activity you undertake. Do you just walk or do you run there? Do you come with a group of people and your common visit improves social cohesion? What is your mental state, your mindfulness? Do you walk through the forest and think about your work worried? Or do you really notice where you're working? So all these factors will impact on your final sort of experience after you visit the place. And similarly, there are external factors which can affect you. And here we see such mediators as cultural values and upbringing. I mean, some people may be brought up in families which never visit woodland or forest, or woodland may be a place of danger for them because of some cultural reasons. It also will depend on your mental well-being status. Are you already under stress, or are you feeling well? And on your socioeconomic status. Do you worry about your work and what to get to eat next day, or are you wealthy and well off? All this impact the results of interaction with nature. We had a lot of interviews with experts, as I mentioned, during first study, and they gave us some basically quotes from their interviews you can see in this table, comparing different methods which we suggest to use to value mental health. And in principle, I mean, they agreed with our decision what to use in the first place, which is avoided cost approach as a start is the best start because it's the least troublesome method in terms of double counting and availability of data. I wouldn't dwell a lot on all these quotes from experts. You can check them later because I notice I'm already running low on time. So when we do study which focus on monitoring visits to Scottish woodlands, what kind of evidence of benefits we found out? Well, we found that very strong evidence that visits to forests deliver a wide range of health benefits, as well as social and cultural benefits by supporting physical health, alleviating stress, supporting general well-being and happiness, facilitating social contacts and improving connection to nature. Again, same story as the first study, the delivery of these benefits is significantly influenced by a range of mediating factors, which I already discussed enough, so I wouldn't stop on this more. So how can physical benefits can be valued when we talk about visits to forest? So when we record data on types of activity performed during the visit, we can calculate metabolic equivalent task values performed during an average visit. I'm sure that if you're not familiar with metabolic equivalent task, you can easily Google it and find out what it's about. But basically every task we perform during a visit, either just by walking or by exercising or by fast walking, can be converted into a relevant number of metabolic equivalent task value. And this later can be used in combination with the frequency of visit during a year to estimate value of quality adjusted life years, QALYs, which can be later valued given our last step. For example, for 30 minutes of moderate intensity physical activity visit a week, it will amount to about 3 MATs over a year for and over a year for an individual, it will generate an additional 0.01 quality adjusted life year. And the value of 20,000 pounds per quality adjusted life year used by NICE, by our National Institute for Clinical Excellence, this will be equivalent to 214 pounds per person per year visiting woodland. So we just give you an example how you can move from recording what people do during their visit to actually valuing this in terms of health benefits. But now I move to the last project, which is an application of avoided cost approach to the valuation of mental health benefits. And here is a table of pros and cons of using this approach. And many of these pros and cons I already mentioned. The benefits of using avoided cost approach is that it reflects market costs, so cost to public sector, National Health Service, and in this way minimize the risk of double counting. And it provides a conservative lower bound estimate for mental health benefits in compliance with natural capital accounting principles. What is the disadvantages of this approach? They're quite similar to many other methods. High quality data on association between avoided mental health illness and natural environment visits are lacking very often. Data on poor mental health costs is often also very sparse and very general in nature, so it's not very specific to what illness does, how much what illness costs. But overall, suitability was considered good, and we think that this approach can provide a conservative estimate of mental health benefits. So during applying this method to mental health benefits of forests, we identified 4 different pathways which you can use to apply these valuations. And we call them visits to nature, physical exercise, antidepressants and street trees, or proportion of green space. And for each of these pathways, I provided a reference and a description. So visits to nature is highlighted because this is the pathway we chose to use with avoided cost approach as our preferred pathway, because it seemed to be providing least problems. It is based on research by Shanahan et al., which reported that visits to outdoor green spaces of 30 minutes or more per week is associated with a reduction in the prevalence of depression in population by 7%. So from that numbers, we managed to unwind all this story and provide an estimate. Physical exercise pathway is clearly based on physical exercise in nature, and is based on move stools developed by Sports England. And there is a reference from 2016 in our report, which again make a link between doing physical exercise by people and reduce incidence of depression. The third pathway used with this approach is antidepressant prescription and the amount of trees per kilometer of street in London. This is a work by Taylor et al. In 2015, which basically showed that there is a 1.18 not percent, but times decrease in prescription per population in London related to an increase in trees per kilometer of street trees in London. And the final pathway, proportion of green space, is based on 2-hour research, which basically find out that the greater green space in the area where a person lives, the greater is their mental health and the less mental health issues present in the area. This slide presents mental health cost avoided costs, which we used in this study at 2020 prices. It's both provide references and type of cost. For example, depression, annual treatment cost is 1,600, and annual employment-related costs, so missed days due to illness, about 1,100. Same for anxiety. The third line is a combined sort of non-specified mental health conditions, which is just a marker CMD-NOS. Sorry for this. It's everything else except depression and anxiety. The second table on this slide present also cost estimates for mixed mental health conditions based on proximity-based pathways, which are last two pathways, proximity to green space or proximity to street trees. So I wouldn't dwell on this, they're UK specific, and I'm sure for international audience, they can find the correct treatment costs for their countries, if possible, of course. So assumptions we made to derive value in this avoided cost approach. So visits to places with trees lead to a 7% reduction in anxiety-related costs. Findings of reduction in mental health condition prevalence from visits to the outdoor apply equally to visits to woodlands. Visits made at least several times a month are equivalent to visits of at least 30 minutes per week. And people visiting woodlands are representative of the general population in terms of their susceptibility and incidence of mental health conditions. I mean, some of these assumptions may feel quite strong, but that's what we needed to proceed forward. And estimation steps on the next slide, which you see now, is first we estimate proportion of adults which regularly visit woodlands in each country of UK, so Scotland, Wales, England, and Northern Ireland. When we multiply this by 0.7, which is 7% reduction in the prevalence of 3 major mental health conditions. And finally, we multiply this by associated avoided cost of treatment and working days lost. And when we apply this cost of working days lost, we only apply it to working population, of course. This is an important qualification, only adults aged between 16 and 64, rather than everybody. And if we have a co-occurrence of more than 3 or all 3 mental health conditions, we also downscale the final result by 0.74, which is a recommendation from our other references. And here is the final numbers, which you probably can happily see. So according to every pathway, the numbers are reported by the constituent countries of UK and the total for UK. And you can see that our preferred visit to nature pathway amounts to £185 million of benefits due to UK woodlands per year. This is a per year numbers, annual values. And below this table, you can see that when we consider all factors, we decided that it's possible to aggregate visits to nature pathway and the third pathway, which is based on antidepressant and street trees, because they work through quite different ways and they wouldn't provide any double counting problems. And this aggregated value is one I reported on the overview slide, which is £202 million per year of benefits to mental health. This next slide provides the natural capital values of these benefits. And what we did, as recommended by UK government, we considered these benefits over a time span of 100 years and using appropriate economic discounting, estimated the asset value of these benefits provided by UK woodlands. And again, as you can see, the total number when we aggregate visits to nature pathway and antidepressant pathway give us something in the range of over £12 billion, which is an asset value of woodland, trees, and forests providing mental health benefits. So these are first numbers for UK, and I'm glad to share them with you. We are quite confident that that's correct. There are also numbers for other pathways, but they are either too small or quite big. And in the report, we explain why we decide to choose visits to nature pathway and antidepressant pathway as our preferred pathways. For people from UK, I can put these numbers in context. For example, recreational visits to woodlands in UK are valued at about 557 million per year. So our 202 million per year is quite in the right ballpark, you would think. In the same way, the last bullet point, you can see that NHS England is planning to spend about £11 billion in 2021 for mental health in England. And again, our asset value of mental health of over 12 billion is also sort of not outrageous, not small. So this just gives us a confidence that the numbers we came up with are quite reasonable. And I think there is no time for me to go into research gaps and recommendations, so I will skip this slide. And what I would say is that thank you all for listening. And what I mentioned on the first overview slide, that if you want to evaluate mental health benefits, you need to monitor and measure it. This is a sort of a first step on the way to valuation. Thank you again. And I'm stopping.
Brilliant. Thank you very much, Vadim. Fantastic. I think that was really interesting. So much great information. I've got a feeling a lot of people are going to be asking if they can see your slides after this one. So is that going to be a possibility if we can share?
Yes, I will supply my slide after today's presentations, and I'm happy for the PowerPoint slides to be shared because there is lots of notes there also explaining something on the slides.
Brilliant. That's great. Thank you very much. Yeah, lots of information. So anybody who wants the slides, please feel free, drop me an email, john@trees.org.uk, and we'll get that sorted for you as soon as we can. Brilliant. Thank you so much, Vadim. And now we carry on straight on to our second speaker, Bianca. Welcome, and over to you.
Here we go. So I'd like to talk to you today about urban trees and woodlands and a piece of research done earlier this year looking at public perceptions around urban trees and woodlands, and then thinking through some initial ideas we've got about trying to sort of link this to the idea of One Health. And just to introduce myself before we get going, just to let you know that I'm a senior social scientist with the Social and Economic Research Group, and we've been looking at the people and trees area for around 20 plus years. So if you've got time afterwards and you have got any interest in the work we do, you can follow this link and generate a list of our relevant publications. And if you want to follow us on Twitter, we're regularly letting people know what our latest research looks like via that particular platform. So the first thing I wanted to do was just stop and think about this idea of One Health. It's sort of come up the agenda with COVID in particular and the increasing incidence of animal diseases that are passing across into humans. But the idea has been there for a little while longer than that. And it's a very simple concept, really. And that is that you need to think about systems holistically. You need to think about environmental health and maintaining that environmental health. You need to think about animal health and maintaining animal health, and that's domestic animals as well as wild animals. And all of those things together, when you think about human health, are all interrelated. So where environmental health, animal health, and human health cross over, that's the sort of One Health area. It's just trying to say in a different way that we're all interconnected, and the health of one part of our ecosystem, whether that's the environment or other animal populations that we share the planet with, interacts with our own health. So just to put that concept and idea up there first. I think that's interesting because, of course, all of us who are tree people in this meeting today understand that trees sit in that crossover, really, because trees, particularly in an urban context, are providing ecosystem services, ecosystem health services. They're contributing to human health. So we know about all the good work they do in terms of shading, in terms of managing microclimates within city and urban contexts. And they're also providing a lot of services for wildlife and for domestic animals. So when we're thinking about that One Health concept, to me, it's immediately appealing, particularly coming from a tree, woods and forests research background. When we think about trees in our urban environment over here in the UK, we know that there are a number of really significant issues facing our urban tree landscapes. One is that the public support for trees in an urban context seems to be quite variable. Sometimes trees seem to be looked at relatively positively, and sometimes they're seen more as a liability rather than asset. So you can have different communities within an urban context supporting or perhaps not supporting the trees that are there, and perhaps even the trees that could be there in planting programmes. We know if you look across the UK, we're similar to other countries where one city or one urban context may have quite a different canopy cover compared to another. And even within cities themselves or urban centres themselves, different neighbourhoods will have different canopy cover. We know the age of stock, particularly in British cities, is an issue. A lot of the tree planting that was done in urban contexts was 150 years ago or so. And we're also increasingly aware that the type of tree stock that we have within urban environments may not be that stock best suited to the climate that is to come. So lots of important issues there when we're thinking about maintaining that central role that urban trees and woodlands have in maintaining that sort of One Health nexus. And thinking about this issue of public support, it's very critical that the public do support trees within the urban context. And what we found here in the UK, that it's not that there's no research looking at the public's attitudes towards urban trees, but there's significantly less than there might be in other countries. And when we look at the evidence base amongst the urban population, what do the urban population in the UK think about their trees? The research that we do have is actually very old, so more than 10 years old. So the overall objective of the research that I want to report to you now is overcoming that evidence gap. So we think about the evidence that we do have. So if you come from the UK, you probably know the public opinion of forestry surveys. They run on a regular basis. And we have in the past had 1 or 2 questions in that nationwide survey that look at urban trees. So this is from 2017. It's looking at the public opinion of forestry survey specifically for Wales. And what I thought was interesting about this is that if you look at this sort of time series, the aesthetics and the aesthetic benefits that trees provide in urban contexts are important, but sort of slowly creeping up on that list over time are some of the sort of One Health benefits. So we've got wildlife is mentioned here, and we've got taking carbon dioxide out of the air, slowing climate change, those kinds of ecosystem services becoming more important. And looking at the numbers at the bottom of that table, at least one reason was mentioned by the people who took part in this survey for identifying the benefits of street trees in this case. So also from that same survey, just wanted to have a look at the other side of the coin. So what I thought was interesting about this is that people do identify disadvantages of street trees in the Welsh urban context, but the numbers are much lower. So what one can perhaps take away the message that from that research in the past, the benefits probably outweigh the disbenefits. So those 2 slides showed you Wales and street tree research from the past. This is looking at research through that same survey, the Public Opinion of Forestry Survey, the same year, 2017, when a question was asked in England of English respondents, not just about street trees, but about urban trees in general. And this was an interesting question. So the public who took part in this survey were asked where they saw the priorities for spending public money on urban trees. And what came up here as most important to the respondents in that survey at the time was trees in public parks and gardens and small urban woodlands close to their home were the places that they thought money ought to be spent. That's quite interesting because in that same survey, 1/5 of those people who answered that survey across the UK, so not in any particular country, actually said that they didn't want to see any public money spent on urban trees and woodlands at all. They didn't think it was a priority that the government should be concentrating on. So thinking about that past research, I think what we felt was it's not complete in terms of the public opinion of forestry survey. It's just 1 or 2 questions. We don't really know that much about urban people's perceptions. And what has changed significantly in the last 5 to 10 years is a much wider general appreciation of the biodiversity crisis and a much wider general appreciation of the climate crisis as well. So one of our key motivations for doing this piece of work was to say, are those results from the past still valid? Have people's opinions changed? And if we ask a broader set of questions, what will come out of a new piece of work? Particularly if we focus on talking to people in urban areas rather than the population in general. So as I say, we conducted this piece of work at the beginning of this year, 2021, and we quite often use qualitative and quantitative methods in our approaches. So this was a mixed methods piece of work. And we wanted to investigate how urban trees are perceived by these contemporary urban communities And the other thing we wanted to do was find out whether we could detect any differences in the answers given by socio-demographic factors. So much like the factors that Vadim was talking about before, we were looking at were there any differences by age class, were there any differences in responses by ethnicity, and were there any differences in responses depending on somebody's socioeconomic group, which here in the UK is a combination of their education, their income and their profession. So we took a 3-step methodological approach. So we started off with focus groups. So the focus group sort of scoped out general ideas and general thoughts that people, members of the public had about urban trees, and helped us to identify areas that we should question more intensively. We then moved on to putting together a national survey. We wanted this to be statistically robust, and we wanted it to carry forward some of the things that came up in those initial focus groups. And then after the survey was conducted, we did some more focus groups to probe into some of the results that had come through from the survey that we thought were surprising or we wanted a little bit more detail about. So what we find with the focus groups and the qualitative data is that you get a rich seam of the why kind of questions. Why are these patterns there? Why do people think these kinds of things? Whereas the survey gives you the pattern of what people think, not necessarily why they think it. And at this point, in my little schematic diagram there of the method, we worked in association with Forestry Commission England, with Network Rail. So they are the organisation that manage the UK's railway infrastructure. We worked also with the Woodland Trust, and we worked with the Mersey Forest. All of those were our key partners. We also had other stakeholder organisations such as TDAG, and at each point in the development of our methodology, we had open and frank discussions with them about question wording and the way in which the survey and the focus groups were travelling. So for those of you who want to know what the makeup of the people who we spoke to was, so the first focus group and the second focus group together, we had 68 people talking in those from a mixture of different urban, suburban locations. And our national survey, 6,000 people responded to that. So there were 4,500 from England, 1,000 from Scotland, and 600 from Wales. So we asked, we did this through a commercial marketing survey company, and we asked them to do the recruitment for us. And that helps us a lot because we can specify the kind of population we're looking for to answer the survey. And it's slightly skewed towards the younger end when you look at the age categories, because that's reflective of contemporary urban society in the UK. And we just about hit the targets for the right balance of ethnicity within our respondents. So what were the results to come out of the survey? Well, I thought I'd just start off by showing you what it was that people appreciated about urban trees. And it maps quite nicely onto the 3 parts of that One Health diagram. So people were able to talk about the 3 most important benefits being CO2 reduction, biodiversity, and the provision of clean air. And that came out very strongly from the survey, those 3 things being the top 3 things. And it also came out quite clearly from the focus group discussions, where people were very overtly talking about ecosystem health and saying things such as the person here has said, I think trees have got a lot of health benefits in terms of creating a breathable space. When we look at the health benefits to people, very, very, very much so through the qualitative data, people dwelt on the mental health benefits of urban trees, wherever they happen to be located. People thought that either trees would give mental health benefits to people, or they were able to explain through the focus groups how they themselves had benefited in terms of mental health. There was very little mention of physical health. It was really mental health that came through from the answers that we got. And then perhaps slightly surprisingly to me, there was quite a lot about biodiversity. So biodiversity came up in the top 3 responses. And then when you unpick what people actually said about that, they were talking about wildlife associated with urban trees and urban woodlands. And I was quite surprised that there were sort of health-related comments. So here's a direct response from somebody. Trees have health benefits by promoting wildlife as well, said this person in England. And then we get more talk about the appreciation that people have, that if you've got trees, whether street trees or in woodlands, you get all kinds of other wildlife. A person talking here about tawny owls and bats. We had mention of other birds and butterflies, and people generally appreciating that as part of the global suite of benefits that urban trees provide. So here we're asking people then, okay, you recognise all those benefits. What do you think then about the level of urban tree cover? And what we've discussed, and I'm sure many of you will appreciate this, when you talk to people about their actual neighbourhood, where they're located, where their house is located or their flat is located, they sometimes don't have quite the same feelings about trees as if you're talking about trees within their city or town generally. And a tree is not just a tree. Trees are different, aren't they? There are smaller trees and larger trees. So what we asked people here was about the level of urban tree cover in their neighbourhood, in their town or city generally, and then what about the level of tree cover in terms of larger trees? So here you can see the overall results there. And sorry, I'm just trying to find my notes here. I'm just trying to find the figures. She's gone wrong. Okay. So you can see that people being satisfied with the trees in their neighbourhood is ever so slightly lower than trees overall. They are interested in larger trees, and we've got between 35 to 40% of the people who answered the survey saying that perhaps they wanted more and bigger trees. And looking for differences along those sort of lines of socioeconomic difference, we found that men and people who were employed were more likely to say that they wanted more trees and bigger trees compared to women or people who were retired. So I'm not quite sure how to interpret that result. So people spoke a lot about tree loss. 28% of the survey respondents said when they thought about the tree cover, it was actually the urban woodlands rather than the street trees, which they felt were the most important habitat to protect. And there was a lot of discussion about urban densification and development, which was seen as a key threat. So I've just put up from the focus groups here a couple of quotes from people in those discussions. They can see that cities need to grow, but there's a general feeling that cities are growing very fast, and the idea of densification is actually sucking up a lot of green space. It might not be the best quality green space, but those small patches here and there are disappearing at a rate of knots. And this idea of strategic thinking and planning comes through again. We'll see in another slide. So thinking now about where people felt trees make the most positive contribution, what this slide is showing is that those urban woodlands and parks that we've already said are so important, just come up again as being where people feel the greatest benefits are coming through. You see, we've got urban woodlands, parks, community gardens, canals, rivers, and private gardens there, which is quite interesting. When we think about any differences here, it was quite interesting that if you look at the white population compared to the respondents who are coming from a Black, Asian, or minority ethnic background, we see the same order in terms of the ranking, but the scores from the white participants were higher than they were for those people coming from Black, Asian, and minority ethnic backgrounds. So then we wondered, if we're thinking about the great push towards tree planting, so that's something that's our governments, our various governments in Great Britain, in the UK, have all committed to. So there's a big push towards tree planting at the moment. We wondered whether those same spaces would be valued as places to plant trees. So that was the question that's being illustrated here in the survey. Where would people like to see any trees planted? And we've got strong support again for urban woodlands, for public parks and recreational spaces. And sort of slipping down there to the bottom end where people are not quite so keen or slightly neutral, or perhaps there's a greater level of non-support. There's a bit more of a risk assessment going on here around planting against railway lines, roadsides and roundabouts. So there was quite a lot of difference here by ethnicity and by age, and also by income and education. So those with higher income and a higher education were far more supportive of tree planting in general terms. And if you were white, you were more likely to be supportive of tree planting in all of these areas in general terms. So in the focus groups, we wanted to delve into this result about parks and urban woodlands being quite so important and quite so valued. So, why? And through the discussion there, what we found was people said it's the type of engagement that you have in parks and urban woodlands compared to street trees or trees beside a railway line or trees beside a road. And looking at the two quotes down there at the bottom, quite often people were talking about that type of engagement in terms of human health. So we've got a lady here talking about the fact that she's able to walk in urban woodlands and urban parks and get fitter. We had similar comments about the size of the trees in those contexts being quite different. There's a different management regime, there's a different landscape context, so it's a much more natural kind of context. And the biodiversity within urban parks and urban woodlands was perceived to be far higher. So all of those things together were, on balance, providing a very positive suite of health-related benefits over the disbenefits that some people were associating perhaps with street trees or trees alongside railway lines. So what we're trying to show on this screen is about engagement and attitudes to urban trees. We asked people here to score various statements. And what I think is interesting about this is that if you look at the top result, where people have agreed strongly, you'll note I notice trees comes out top there. And then the next three in the series, the second most strongly supported statement is that trees are good for health. So this whole health thing comes through again, and that's mental and physical health that people are talking about. Care comes through as a third most strongly agreed with statement. I care about trees, and my town is better for trees. So again, I think that's interesting because it resonates for me with that whole One Health set of ideas. What I thought was interesting about this chart as well, if you look at where the most responses around strongly disagree are, and the most neutral responses, then it's the statement about I feel most connected with trees since lockdown started, COVID lockdown started. And that sort of goes slightly contrary to other surveys and other pieces of research. So interesting one to delve into a bit more there. I thought also what was interesting here is that right down at the bottom, I feel that trees are well cared for, or I'm concerned about pests and diseases being an important threat to urban trees. The statements agree and strongly agree are quite low there relative to the other answers. So whilst people can see the health benefits to themselves and to ecosystems and to their urban environments, concerns about the health of the trees are not figuring that highly in people's responses. So this takes us on to looking at urban tree management, picking up on some of those ideas about, do people know how trees ought to be looked after? And people do like managed trees in an urban context. That came through quite clearly. And damaged trees, so trees which have got branches hanging down, branches missing, and so on, 54% of the survey respondents said that that really annoyed them. And the basic message was that a well-managed tree within an urban context was a healthy tree and was therefore best for human health. Those kinds of intrusive management devices that we've seen in some parts of urban Britain, so I'm thinking here about the spikes and the nets and very heavy crown reduction, spikes and nets to stop wildlife, heavy crown reduction, sometimes poor arboricultural practice. The public universally disliked those. Because, of course, we've already seen on those previous slides that wildlife is seen to be an important benefit of trees. So even if people don't like the fact that they might find bird's mess on their car parked underneath a tree, in the balance of positives and negatives, the positives are winning out. And then the perception of trees bringing wildlife and biodiversity into the mix, that's winning out. The other thing around management was quite clear from the survey and the focus groups was that people feel quite disempowered and unable to become involved in tree planting and tree management. And that's perhaps most often polarised over here in the UK when we see people being annoyed by street tree removal, and 50% of respondents in the survey said that that really annoyed them. What was interesting here, though, is that talking through in the focus groups and in the results of the survey, that people from a Black, Asian and minority ethnic background often said that they felt more able to take part in decision-making about trees in their neighbourhoods compared to white respondents. And they were also more likely to already be donating to tree-related or environmental charities. What came through when we're thinking about that strategic planning and the management, the discussions in the focus group sort of rolled over into the need for more trees in poorer areas and places within urban centres that had less tree cover. So there was a strong theme around equity, and there was a very, very strong theme around the need for strategic planning and the enforcement of planning. So I was quite surprised that many of the participants in the focus groups had quite a nuanced understanding of what planning might be doing for trees, and they had quite strong opinions about the lack of enforcement and quite strong opinions about the lack of strategy in terms of thinking through where trees should be. So the first quote here from the lady in England is basically about experience in her urban context where trees were planted by the council, and then some development happened a few years later and those trees that were planted were then taken out. So that she found very annoying. So coming towards the end of the slides now. So if we're talking about looking after trees and planting trees, well, we want to know who the public think ought to be paying for trees. So around 70% of survey respondents thought that more government money ought to be provided for looking after urban trees and getting urban trees in the ground. 40% of people said they thought they might be prepared to pay more tax. But what I thought was really interesting is like the top answer there on the far right is this idea that came through in the survey that people felt polluting industries should be paying more towards planting trees and the upkeep of trees. And people here were thinking about those services that urban trees provide around clean air and carbon. So they also included, amongst polluting industries, really polluting activities, car drivers. And I thought that was quite an interesting set of results there. However, when we're thinking about money, when we talk to people in focus groups about where they thought the money should come from, what level of spending they thought ought to be focused on trees, having had all this fantastic sets of opinions and perspectives around all the important health benefits that trees bring in urban contexts, the bottom line is that for many people, they didn't think that councils or government should necessarily be spending money on trees when there were other priorities. So foremost in people's minds, obviously, will have been the pandemic over the last couple of years, but also councils are under increasing pressure to provide a whole range of different services to an expanding urban population. So there were some strong opinions that perhaps some of those other services ought to be receiving money rather than trees. In terms of people understanding how much it costs to plant trees and manage trees, there was very little understanding of that at all. And then just a couple of slides to conclude now. So we also asked, okay, so if people are interested in trees, they care for trees, they notice trees, they recognise all these benefits, are they prepared to actually take part in any actions for trees? So this was a question asked in the survey, and the majority of people, around about a third, were not interested in doing any of the activities there to support trees at all. And about another third said they were quite interested in planting a tree themselves, which might be in a garden, their own garden, or somewhere else. But in terms of all the other kinds of activities that we had as options in the survey, there was very little interest. And in terms of providing an other for people to suggest their own activities in the survey, very few suggestions. Okay, so just to conclude then, so this is the sort of a preliminary show of our results. So we're currently still working on a more in-depth analysis, but I think I'm convinced that that whole One Health concept is a useful way of exploring the relationships that people have around trees in the urban environment, rather than just these checklists of benefits that people perceive or the disbenefits that people perceive. And I'm really struck by all those health benefits that were really quite high in respondent perceptions about what urban trees do for them. So I think there's some mileage in trying to apply this concept a bit further as we continue with our analysis. The other thing that I think came through quite clearly is that both in the survey and the focus groups, respondents were making quite a clear division between public and private benefits and public and private responsibilities. So there's definitely a feeling that there should be public support for public human and ecosystem health benefits through trees in the urban context. And that whole idea of the private benefits that companies and people engaging in polluting activities are undertaking is also an interesting one, I think, to follow through on. I think the overall takeaway message as well here is, for this survey at this time, I think that the urban trees and woodlands people discussed were very much seen as public assets, not so much as liabilities. But this call for some planning and strategic action was quite strong. The issue of equity in the public distribution of trees and the benefits that they provide was quite a strong theme. The idea around voluntary action amongst the public around trees and tree management, I think, is still likely to remain at a relatively low level, because we had more questions than I've shown you in the survey and in the focus group around people volunteering to take part. And even though the health benefits that urban trees provide meant that people believed there ought to be some kind of budget for them, it wasn't really linked up to their thinking about wider health and economic issues. So there's still a job of work to be done there. So if you want to follow up on the project, here's a quick screenshot of the page where the future outputs from the research will be published. So that will happen over the next month or so. And thanks again to our sponsoring partners. That's it. That's all I wanted to say.
Thank you, Bianca. Absolutely brilliant. Again, we've had loads of people asking if they can have your presentation. So you put your details up there. If people grab them, then please feel free to email Bianca. Otherwise, drop me a line and we will sort it out. Great stuff. Thank you very much. Okay, lots of questions, lots of comments and chat and all sorts of things going on. We'll work through some of the questions we've got. Now, I'm going to ask Anthony's question first, which is kind of to both of you. And I was going to edit Anthony's question down because it's a long one. And I thought I was going to get away with it because Anthony had to go to a meeting. But he said that he was the only person who turned up at that meeting. So he's now back. So welcome back, Anthony. And I'm going to give an edited version of your question, which essentially is, how can social prescribing, including trees, be both provided and funded as a legitimate, effective, and coherently organised part of treatment procedures? We're all starting to understand the importance of these things, but how do we actually get social prescribing and green prescribing recognised properly? Vadim, I'll start with you.
Thank you, John. A very complicated question, clearly touching on so many sensitive areas. where to start. I think education is the key. In general, when you talk to the public, as Bianca showed, public understand that being in nature is very important for their health. And now we also see that it's also not only important, but even if we touch the tip of this health benefits iceberg of only avoided cost to NHS, we can see that it also has a lot of monetary value on top of it, on what we all understand it's good and important. And how to make it non-controversial and sort of working, well, I don't have an answer. I think as we keep on moving and showing politicians, both in the government and the local governments, that people visiting green spaces lead to a better, healthier population in their areas. As a result, including savings to their local health service in terms of reduced prescription rates and reduced labor days lost, however sort of harsh and economic it may sound, they will see that it is a total win-win if we of course think in terms of trees also as abating climate and sort of mitigating climate change, both by providing cooling effects and carbon sequestration. I really see no conceptual or principal objections for social prescribing. The real question is, how does population feel that they pay the tax for healthcare service, and when they come with a problem, they're told to go for a walk. They may think, oh, so where did our money go? And why we are doing something basically for free for our health while we pay a lot of tax for it. But I think it's still, again, about educating the public and showing them this research. Probably it's part of our task too, to promote it more. I better stop here to let Bianca to say anything.
Thanks, Vadim. Some good points there. Bianca, what do you think?
I don't feel very qualified to answer, to be honest. So I think as researchers, what we can contribute to the debate is the evidence, but not all evidence is equal. So the evidence that the Treasury wants is not the same as the evidence that a clinician might want. The clinician might want to know, what actually is the impact? What is the mechanism? How does it make a difference? Treasury obviously wants the kind of data that Vadim can produce, and whether policy, clinical practice, and as Vadim says, the public, whether all their ideas converge is another matter altogether. So I think we just got to keep on providing the evidence and trying to make the point. That's it.
Thank you, Bianca. Bianca, I'm going to come straight back to you with a couple of quite specific questions, because while you were giving your presentation, there was a bit of a flurry of activity in the chat of people saying, but I've never been asked my opinions in a forestry survey before. And who is being asked these questions? And there's lots of questions kind of on a theme, but Maggie's asked, how was your sample selected for those surveys and how did you advertise for participants? And Jackie's asked a similar question, how are the surveys distributed, as there's a number of people on the chat who've never had one. So could you tell us a little bit behind that, how that sort of works?
Yeah, okay. So that's a really good set of questions. And as researchers, how we put together our sample is something that we spend a disproportionate amount of time arguing about. So there are various ways in which within our group we conduct surveys. Sometimes we actually go out and ask organisations like yourselves to try and recruit people to a survey for us. And what we end up then with is quite an opportunistic sample. So whoever has seen your newsletter or your call out for someone to take part in a survey will arrive, and we have no control over that at all. For some pieces of work, that's okay because you connect with the very community that we want to talk to, but for other pieces of work, it isn't okay. And that also takes quite a long time to recruit people. So what we've done much more recently, and this is also the methodology that large public opinion of forestry survey does, is we use commercial marketing companies to recruit for us. What they generally have are databases of people who have volunteered to take part in surveys. So they have data banks where they will know the age of people, their ethnicity, where they live in the country, their postcode, and various other bits of information that those people have consented to share as they've placed themselves on the database. So what we can then do is we can say to the company, so we're looking for a survey which is representative, and it's representative in these terms, by locality, by age, and the other socio-demographic characteristics that we want. So then they will then activate their database, and they will ask people on that database to come forward and take part in the survey. Usually there's some kind of remuneration for that kind of recruitment to the person taking part. And they will be feeding back to us on a day-by-day basis. So at the moment, we've got this number of people with these characteristics, this number of people with these characteristics. It's moving in that direction. Is that building up the survey sample that we're looking for? We use things like the ONS neighbourhood statistics and the census to work out what our relative proportions of people with different characteristics should be. So that's always our guide. The other way that we might use a market survey company is through an omnibus survey that might be carried out face-to-face. So actually, where I lived previously in North Wales, I think people knocked on my door about 4 times, and they were actually carrying out omnibus surveys where there are a list of different questions that different parts of government or different organisations want to ask of the general population. And a person will walk through a shopping centre door to door, and they will have on the usually the handheld computing device that they have with them, they will have the makeup of the kinds of people that they want, and they will keep looking for those people until they get a person that fits those characteristics, and then they'll ask the survey questions of them. So that's the other way that it's done. So we sit in a room and work out what we want, and then we find a way of getting what we want, is the short answer.
Thank you, Bianca. I'm going to sort of slightly follow up with a question to that, and then I'm going to put it to Vadim afterwards as well. But a couple of people have also made the point about that everyone's fascinated by surveys and survey samples and how you get them. Rosanna's made the point about when you spoke about the responses from white people, whether or not that was separated out into white English, white Welsh, or whether that was separated out into people who have different sort of nationalities within the UK. And similarly, Jackie's asked, if we surveyed a larger proportion of the population, would we get different data? And should we be looking at regional differences?
Yeah, so we can, within our data, yes, we follow the census classifications. So that does break down those larger groups into smaller ones. So you could go down to Chinese origin, Asian origin. You can go down into different kinds of white as well, white Welsh, the way that people identify. So we use that classification. We also have regional classification within the survey data. So we can look at it that way as well. And then sample size is another point at which we argue. The sample size that we've got, 6,000, we've got a very high level of confidence and reliability with that kind of sample size. If people are interested, what you could do is go to Google and look for a sample size calculator, and it will tell you, if you know the size of the population, so the population of the UK, 66 million, it will tell you what the sample size should be in terms of the survey to be able to give you a representative and reasonably accurate, confident sample size. So statisticians always talk within confidence limits. So usually the larger the number, the less the degree of uncertainty, the greater the degree of confidence. But it's a funny sort of relationship. If you've got a small population, you need a disproportionately large sample for it to be reliable. If you've got a very large population, it seems to be a disproportionately small sample to give you a representative group. But Google sample size calculator and see where that takes you. A fascinating rabbit hole.
Well, I'm amazed at just how excited everyone is by surveys and sample sizes. So thank you, Bianca. That question there mentioned regions, and this might be the worst question in the world because I can't remember the exact statistic, Vadim, that you mentioned. But one of your last slides broke down the UK into regions, and it looked like some really interesting results with very different financial sort of returns and savings between England, Ireland, Scotland, and Wales. Like I say, this is a really bad question because I'm not actually asking what side it's about, but. Oh, you're on mute, but I imagine all you're saying is, John, what the hell are you asking me? That's not actually a question. So that's okay.
That's fine. No, we did present our numbers by UK countries. That's right. We didn't go down to the lower, sort of smaller areas like regions. So it's only by countries. The returns are not different. They're nearly all the same. I mean, they're driven by population visits, which is obviously driven by the availability of accessible woodland, trees, and whatever else, or the greenness of the streets. So there will be variations among countries because we know that there are slight different preferences in terms of visiting woodlands between Scotland, Wales, and England. And of course, Scotland is also affected by bad weather much more than southern England, for example. So the number of visits may be a bit less per person. I don't know now exact statistics to answer. But this is the driving force. So how many people visit woodland? How often? If you can, obviously, you can find two different local authorities where the situation is very bad and very good. But our general numbers, they're actually very standard for England and Scotland and UK. So because the cost of illnesses are determined by National Health Service, and there is no variation between Scotland, Wales, Northern Ireland, and England. So that's what I can say on the.
Thank you very much, Vadim. I'm going to come straight at you, Vadim, with another question again, and then actually I might ask Bianca too. But question from Ian. This is an interesting point. Are there any studies that have investigated the difference in mental health outcomes from visitors to parks or woodlands that visit to walk or picnic or jogging versus those that engage through immersion activities like gardening or tree planting? So I suppose what Ian's asking, without trying to put words into your mouth, is to what extent does the activity that people are undertaking in these environments affect their mental health? Is there a physical, the more physical exertion, the better? Is it something like that? How's this working, Vadim?
Yes, I would imagine activity matter. And we certainly came across different activities sort of measured in terms of their impact on health metrics. So whether you go jogging or whether you go for forest bathing, which is very popular recently coming from Japan and Asia to us, it certainly will affect your response, as we said. But this whole link about being in nature, being exposed and receiving the benefits, it depends on so many factors, as we all saw. The problem, which I mentioned in my research gaps lecture, which I couldn't show, but it was just a couple of slides, is that we have very, very niche studies which address this currently, like studies which like maybe include 20 participants doing something different to just general forest visits. We couldn't use this study to derive natural capital account values for UK. So it's basically, my opinion is that researchers are starting doing this kind of detailed research, whether it's jogging or gardening or mindfulness exercise in the forest. How does it all impact on outcomes? But currently, we don't have research which is of good size and maybe even longevity, because it's often important to follow people to avoid just the error of association rather than causation. So I would say they will be forthcoming in the next 5 to 10 years, and we will see a flood of these studies, but they are not there yet. to answer this question now with any precision. I'm sure if you Google or use a Scopus search, you will find a few studies here and there, but they're just not good enough to be adopted by us for natural capital accounting purposes. That's all.
Thanks very much, Vadim. We've got loads of questions, and as always, I try and skip around as to which one I want to ask. But one I've just seen from Jackie, I think Jackie's had a couple of questions. Well done, Jackie. Jackie's asking, for something as so important, would it be beneficial to sort of advertise the benefits of trees on the TV, like you would with sort of the NHS or something? Is this something that you both talked about, public engagement? We just need to be doing more and more of this, surely, just really hammering home to people the benefits of green space, and that will hopefully help them, Vadim, feel that they're not being shortchanged when they're paying their tax for the NHS, but they're being prescribed going for a walk. Is that the sort of thing that this is a question to both of you, really. Is this the sort of thing you'd like to see, a targeted advertising campaign to really get this message across?
Yes, I can imagine a great amount of funny advertising. But any of us who lived through a few last heat waves know the difference. Standing on a street and standing under the tree, I don't think you need to say any more. And me being an avid walker, I'm probably in the wrong sort of mind. I can't even imagine that you need to advertise this thing. I mean, anybody who's been walking from a street which is without trees and a shaded alley will know the difference, both in noise, in air pollution just from dust particles, in freshness of the air and ambient temperature if it's a hot sunny day. And I think we just need to send people down to different streets and they will know the difference.
Yeah, absolutely. Bianca?
I think that's a really interesting question. So we have this constant discussion going on at a policy level about the need for a national conversation about trees and tree health, about the need for sort of reinvigorating a woodland culture amongst the public. And I think, my response to that is we've got so much evidence, and then we've also got gut feeling. So I think people know about the benefits of trees wherever they happen to be, urban, peri-urban or rural, but knowing something and behaving in a particular way around something are two different things. So you know that trees provide shade and make life cooler, but you might be anti-tree because of that mess that the pigeons are creating on the top of your car roof. So actually your behaviour is mediated by the things that annoy you, not the good things that we know about trees. And then I think, okay, fair enough. So how do you actually change people's behaviours, not just their knowledge? And, we have had successful campaigns in the past, haven't we? I'm thinking here, your 5 a day. So once upon a time, people thought it was rather trite to have that kind of campaign to move people towards eating fruit and vegetables, but the message was pitched in the right way and people's behaviour has changed. So maybe if we can identify what it is we want the behaviour to be or how we want people to react, then perhaps we can think about the kind of campaign we might want to put together. What's the campaign for? The general levels of awareness are there. The general levels of awareness about climate change are there. But do we stop consuming? No, we don't, because our behaviour is mediated by different things beyond just our knowledge. Same with smoking. So it's identifying what can people do? What behaviours do we want people to exhibit around trees and woodlands, which is a different question, part of the same communications problem.
And I think that actually leads on to a question that I sort of wanted to ask. It's not been asked, but I wanted to ask anyway, which is about, we had that study quite recently, didn't we, talking about sort of 2 hours in nature is going to make you healthier kind of thing. And that's obviously really positive. That's a positive message to get out. But there's a danger, it's this sort of optimization of nature message that it's almost like, well, 2 hours is the optimal amount of time to spend a week out in nature. And, well, if I just spend my 2 hours a week, then I've sort of done nature. So then, anything beyond that must be wasted because 2 hours is the optimal. So we've got to be really careful about how we package this and message this. And I don't know how we go about doing that, really. Less a question, more an observation. But
I think there was lots of messaging in the chat at one point about leave no trace, and the sort of pressures on nature as well. So it's not only about getting people out there, it's getting people out there in the right way. So we have just gone through 18 months where the pressures on the countryside and the pressures, particularly, I live in the centre of Bristol, so I can see the pressures on my urban woodland here and my parks here have been significantly more than I've seen in the previous 5 years. So there's talking through all of that as well, isn't there? Not just get out there, but get out there in the right way. Lots of people don't appreciate the right way to behave or the most positive way to behave in natural contexts. They're learning, they're novices, they might not have done it before. They might not appreciate the values that some of us in this meeting appreciate. So quite complicated.
Yeah, it's one of the problems when you have obviously webinars like this are fantastic and conferences are great, but we do often find ourselves talking to people who already agree with the point of view that we've got, and it's trying to break through into that new audience, I guess, isn't it? So maybe a TV campaign is the way, as was just suggested. We got time for, we got a couple of questions. We'll do a couple more questions. One we will ask from our friend Edgar in Mexico, who's asking both of you whether or not you know if there's any research going on these topics in Latin America. That's where Edgar's in the Latin American Arboricultural Institute. But I guess generally I could expand that out. Around the world, have you got colleagues around the world doing similar studies in their own communities, and particularly Latin America? Vadim, let's ask you first.
Well, very interesting question. A bit unexpected, because it would usually be me asking a person from Mexico, is there anything going around them? Unfortunately, all our 3 projects were very, very UK focused. So we only combed English language literature, of course, and trying to find most similar both mindset, because we saw how mental and cultural constraints or upbringing change your response to visiting the nature quite significantly. So I don't know anything about Latin American research or research in other parts of the world. We relied on a few papers from Australia in our case, just because they managed to do a large-scale studies there. But most of our studies were deliberately selected to be from UK or at most Europe, because we wanted to see similar forests covered and similar cultural patterns covered, because I think they all matter for the outcome. But I'm sure, yeah, you should.
Bianca?
Yeah, I think these are issues of worldwide concern. And before I joined Forest Research, I did about 20 years in working in an international context. So places that I know well are not Latin America, unfortunately, but Asia. And if we think about Asia, there's quite a lot of work coming through from India, from China, from Malaysia, around these same kinds of issues. How do you value the health benefits of woods, trees and forests in different contexts? So in India, I'm aware of quite a lot of work around those issues in an urban context as well. So that certainly exists. And then I'd agree with Vadim, North America, so the States and Canada, thinking about Australasia as well, similar kinds of research into these issues down there too. So a quick Scopus search or a quick Googlate through Google Scholar should turn something up.
Brilliant, thank you. What we're all about here is bringing together people for different projects and to have different conversations and stuff. Paul has put some stuff in the chat over there. Look, everyone, this is good. I wish we knew about all the projects that were born from these webinars, because I think there's lots of different little things going on around the world now for the back of people meeting here. So that's great. Right, last question. Let's do the last one. We are going to ask a favourite question, and I'm saying this slowly just on the off chance that Vadim forgot to go and think about this during his presentation. What is your favourite tree-related book or associated thing? Vadim, are you ready for this question if I come to you first? Look at this.
Yeah. I thought about it. It's The Lord of the Rings, Tolkien. And I put 2 pictures here, a tree bird, famous, tree shepherd from the story, who take care of forests and the beautiful kingdom of elves, Lothlorien. I'm sorry for people who are not aware of this piece of literature, but I think it's very environmental and pertinent to our days. Different people uniting to protect forests in one of the series of The Lord of the Rings, if you prefer movie to a book. So that's my answer. Sorry, it's fictional.
No, fictional is good. Yeah, that's a brilliant answer. And I think you're right. It's a very environmentally minded book and very appropriate to the era in which we're living. Thank you very much, Vadim. Good one. Bianca, what are you going for?
Well, I couldn't decide on a book really because there are so many. So Lord of the Rings would be one, Princess Mononoke might be another. So what I chose to share was something very factual. So I brought along tree top trumps. So I don't know how international top trumps were back in the day, in the 1970s, I think they might have come out. So it's a set of cards and each card has got facts about trees and you play a game, trumping one tree over the other. So can I ask people a question, John?
Yeah, you can ask a question and we'll see who answers it correctly in the chat first of all. We can play this game. We can play this all night. You go for it. Right,
so so that one of the things that is on this card, this is the card for the horse chestnut tree. So what's its Latin name? Ascellus hippocastanum or something like that. I'm a social scientist. I don't know anything about trees. What's its lifespan? Does anybody know the lifespan of the horse chestnut tree? Average lifespan.
Come on, folks, type it in. Up to 400. Sarah said up to 400. By the way, I think these are dreadful questions in a way because it's very variable, but that's my tree officer answer.
I think you're all sort of in the right ballpark. According to this one, it is 300 years. So if you've got 300 years, big clap.
Shiraz and May both got 300 years and James got 300 years.
Brilliant. So how about the number of insects that are attracted to horse chestnut as a biodiversity indicator? Have a guess. Species of insects.
Okay, how many? Sarah said 421. That's very specific. 75. James is saying 400. We're getting guesses all over the place. Bianca, tell us.
174 apparently. And if I were to compare that with the U, if I'd had the U card, if my opponent had the U card, they would have trumped me because the U lifespan is 600 years, but I would have trumped them on the insects because it's only 6 insects associated with the U. So that's how you'd play the game. So fun.
Well, that's also a good statistic. What was the one before you were doing? Was that horse chestnut, the biodiversity of a horse chestnut? Yeah. So there you go, folks. Whenever we hear the native trees are not as good as non-native, better than non-native trees biodiversity, that's horse chestnut trumping you. Right. Well, I think we can make an entire webinar purely out of sort of the Price is Right, higher or lower on these games. We have to come up with some sort of format for that. Bianca and Vadim, that was brilliant. Thank you both so much. Great presentations, great choices at the end there, and thank you for dealing so expertly with the questions. Thank you, everybody out there watching. As we said, we'll get you the presentations if you like them. John@trees.org.uk, email me and let me know. And please do sign up for next week for part 2, in a sort of a loose affiliation of parts, but it's all working together. It's all wonderful. Sign up for the conference, do all the things I always tell you to do. Stay safe. Thank you, Bianca. Thank you, Vadim. Thank you, everyone. Thank you, Steve. Good night. Bye-bye.
Bye.